Okay, I think we have most of our my volunteers here now, so I thought maybe we'd start off with some introductions. So first of all, my name's Erin Patching. I just work in the undergraduate admissions office. So yeah, that's admission officer, student or program specialist is what I do. And I'm gonna introduce some of our student volunteers we've got here today. So I see we've got Megan, Brianna, and Zachary. And if I'm missing anybody that's also here of our student volunteers, please speak up. Nope, okay. And then we have Zara, our associate dean here. Zara, I'm just going to pass it off to you to start us off with an introduction.
Sure, welcome everyone. Thanks for joining us on this lovely sunny afternoon for October. So it's great to, if feel free to turn on your cameras. It's amazing to see faces and parents if you're out there. So, please don't be shy. Turn on your cameras if you can, but I'll do a quick introduction. My name is Zara Shjani. I am the Associate Dean for Clinical Practice at the University of Calgary Faculty of Nursing in the undergraduate program. And that's the program we're talking about today. And so we've got our students here who will provide a little bit more detail, but I'll give you a quick, probably a 2-minute summary of our program, looking at it from a 360 level high feet. So we've got 4 years, we've got 3 entries. We've got our direct entry students who come straight from high school. And then we've got another entry, which is a transfer degree, where we get some students coming in when they've already started university and they want to transfer into nursing. And then we also have another route, which is a degree holder, where students who already have a degree come in into the program. And so those are their 3 entries that you can come into nursing. And we've got a 4-year nursing program. The degree holders and the transfer students can get it done in 28 months. It still has the same amount of semesters, except they get their first year exempt depending on what they have done. But if you're a degree holder, your first year is usually your physiology, anatomy courses, and your options, your stats and your academic writing courses. And then you come into doing more nursing in term 3 and 4. And that's where you also will see your peers from transition and degree holders. And so, the first term, we look at it from a population health promotion model. So we start off with trying to understand what the population is, and then move into family nursing, and then move into the individual health, where you go into more of the acute care hospital settings. And then you finish off your last year with a specialized term, and then you've got the last sort of term 8, which is really working with a preceptor in the hospital, depending on the choice of your final practicum. So that's a 4-year program. I actually graduated from University of Calgary a long time ago, and so my own journey started here. I loved the undergraduate here. I went off and did my master's in public health at University of Liverpool, and then finished off with my nursing degree, a doctorate in nursing degree overseas as well. But my first step was right here at university, and I always remember my moments here in the hospital and at the university. So I welcome you all. I won't take any more of your time. I'll pass it on to our students who are going to give you their experience of the program, and I'll be here to answer any questions after. So send it back to you, Erin.
Helps when you don't, when you unmute yourself before you talk. All right, I see we have Harneek here now also. So now we have four current students. I believe all of them are in their final year of the program. So which one, let's see, Megan, you were logged in bright and early here, so I'll start with you here. So if you want to tell us kind of about your nursing journey thus far.
Hello, I'm Megan. I'm a term 7 student, so in my last year. I was a direct entry student. I worked for a year before going to the university. Your first year, as Zara already mentioned, is not nursing specific courses. You have required courses, so you have to take those, your stats, academic writing, those type of things. But you also have lots of options, which is a great time to explore your interests, even if they're not nursing related. So second year, term 3, I was in community. I was in the OMA program, which is Opening Minds Through Art, which is kind of an art program for people with dementia. Term 4, I was in long-term care, which you do lots of building patient care skills and building relationships with your clients. Second year, term 5, I was in psychiatric and cardiology, learning and using lots of skills there. Term 6, I was in neurology. And then term 7, I'm in general medicine now.
So, and Megan, I just want to, what are some of the fun parts? Like, what are things that have like really stood out about your nursing experience so far, or even not necessarily fun, but things that have really stood out for you?
There's lots of events held through undergraduate nursing. So there's lots of opportunity to meet new people, make new friends. Outside of nursing itself, there's lots of opportunity to get involved in the university community. It's just I don't know, going into nursing, a lot of people don't really understand what opportunities there are in nursing. So kind of going in and figuring out what I might be interested in and kind of how I can, different areas I can go into was very, very interesting.
Thanks. Let's see, who do we want to go to next? Zachary, do you want to take it from here?
Sure. Hi, I'm Zach. I'm in term 7, so also my 4th year of the nursing program. And like Megan, I'm also a direct entry student. So I started off in 2017 in my first year, like Megan said, taking all the basics courses like stats, kinesiology, and a few options we could take too. So I ended up taking classes like astronomy and history and Greek and Roman studies. And second year we started, and I was in the newly formed one of the Indigenous placements at the University of Calgary. So we sort of went around interviewing members of the Indigenous community and finding out how we could sort of be allies to them for promoting more Indigenous youth students at the University of Calgary, as well as getting a deeper understanding of how Indigenous peoples have been treated in the healthcare system over the last 50 to 100 years. So I thought that was really interesting and an important part of my learning in second year. And then term 4, I was at a long-term care place in an Airdrie. Term 5 is when we started in the hospitals. I was on an orthopedics unit at South Health Campus. So that was really interesting. Got to see a lot of hip and knee surgeries there. Term 6, I was on a split between Rocky View Cardiology and a placement at the Alberta Children's Hospital. So I got to do a little bit of pediatrics in there too. And currently I'm on a hematology oncology unit at Peter Lougheed Center. As for the highlights of the nursing faculty so far, I'd sort of have to agree with Megan. Getting to know the different routes you can go in nursing, not just acute placements like working at the hospital per se, finding out that you can work in the community and you can work in long-term care settings was a big eye-opener for me, and just how flexible nursing is as a career in general. And then also events, meeting people. I met a lot of new friends in the nursing faculty through our clinical placement groups and through group activities hosted by the Undergraduate Nursing Society, like board game nights and academic reviews. So yeah, it's been fun so far.
Great, thanks, Zach. Brenna, how about you take it from here?
Yes. Hi, guys. So I'm Brenna. I am also a term 7 direct entry student. So I started in the fall of 2017, right out of high school. I am an out of province student. I'm originally from Saskatchewan, and I moved to Calgary to do my education. Great decision. I love it here. Yeah, so like my first year was very similar to everyone else's. I took basic classes like anatomy, stats, and ac writing. Anatomy and phys is super cool. You get to do a cadaver lab, so that's like really fun hands-on learning. That's like probably one of my favorite parts of first year. And second year, I also did OMA like Megan, but I was at a different placement. So we weren't in the same group, but we did very similar things. That was fun. In term 4, I did a neuro rehab for my long-term care, and that's when I was able to start seeing like the different members of the multidisciplinary team. So I got to see how like PT and OT and speech language pathology work together to help people like rehabilitate. It was like very, very interesting, and it gave me like a deeper understanding of the healthcare team. In term 5, I was on renal and transplant at foot. Term 6, I did a cardio split at Rocky View with 2 days of mental health at the end with COVID, obviously. And then term 7, I've chosen older adults, and I'm actually back at unit 37 at foot, which is awesome. I love the unit, so I'm super excited. And like my highlight is like very similar to what I think all of us will echo, is that I've loved the events put on by the Undergraduate Nursing Society. It's a great way to get out and meet people, especially being an out of province student. I was able to form a ton of connections, and it's like super nice because in the end, if you are struggling with something, there's always an upper year that you can talk to. There's so many the connections between years that I like really like it. And yeah, also when you get into clinical groups, you get to meet like 8 new people, and it just like is super great because you can meet a ton of people. And I find our faculty and community very, very welcoming and cohesive, and we're always willing to lend a helping hand.
Thanks, Brenna. Harneek.
Hey guys, my name's Harneek, and I'm a 4th year direct entry nursing student as well. I'm in my term 7, or in our final year, and I'm actually in a clinical group at the moment with Zach, and I'm also at hematology oncology at the PLC, Unit 38. And I'll just kind of give like a breakdown of how the nursing program goes, similar to what some of the other students have mentioned. First year, you have the opportunity to really just check out all your different interests and take all these different courses throughout the university. It helps you become a little more flexible, and it's a flexible year where you can take courses such as I took Greek and Roman studies. I loved the sociology course I took, and I actually got to take some courses with some of my friends who are coming to the University of Calgary who weren't in nursing specifically, but we took some of these courses together. So, and I still look back to those times and think about when I had the chance to take these courses, and I think it was a really great time. And first year as well, I think a great way to be involved, as you might feel a little not being exactly in the faculty, is through things like YONC, which is the Year 1 Nursing Council. And I think they did a great job hosting events, both academic and social. It's a great way to meet your peers that are also in nursing, which you might not see in your other courses. So just meeting them and getting to know them, going to different academic sessions, maybe for kinesiology or for statistics or academic writing tutorials. I think it's a great way to just be involved and get to know the faculty and find some peers and friends that you're going to be with throughout the rest of the program. In second year, we actually start, you're more integrated within the faculty with how the current program is set up. You start off with community health nursing, where you learn about the bigger picture. You learn about things like the socioeconomic determinants of health. And you start off with a community placement where you're going to be working with a population, with a specific population, focusing just seeing how you can help tackle a population challenge that they might have. My group was actually tasked with working with the first year nursing students. So we were integrated with YONC and other nursing students, and we came up with ideas on how to manage your stress better and just how to tackle challenging courses like kinesiology. So I think that was a great experience. In term 4, which is your second semester and second year, I was also in long-term care as the other students. And this is the time where you really get to practice your head to toe assessments. This is the time where you learn some of the medical skills, like you get to actually practice the blood pressures and other vital signs that you learn in term 3, and you put them into practice. In third year is you're welcome to acute care, and you'll be in a hospital setting in a clinical group again. This is where you have a nursing instructor, and you're actually in a group of 7 to 8 students where you all, for 2 days of the week, you go together, you go to the hospital, and you actually have a patient that you care for. and you're applying all the different things you're learning in class from pharmacology and physiology and pathophys, and just combining that together to really translate that knowledge into practice and caring for patients themselves. In year 4, which is now where you actually get to finalize and specialize in a discipline. So Brenna, I think, is in older adults at the moment, and Zach and I are in oncology. There's mental health. There's lots of pediatrics, labor and delivery. So there's lots of different disciplines that you get to pick at, and you have a list, and then you'll be placed in one of those disciplines. So, and your clinical actually reflects what courses you'll be taking. So I think overall, the way the program is set up, it really builds you up to that step at the end, and you really see the growth in your practice and learning as well. And you really get to apply that. I think something I've really enjoyed over time is just being involved with the different student leadership groups. I'm currently the president of the Undergraduate Nursing Society. And just overall in my involvement through first, second, and third years, I've made some great friends that throughout the program that are now graduated. I've met some great mentors, and it's just a great way to find friends, get that help and support with the stressful clinicals, exams, midterms, and everything going on. We all go through the same classes, have the same professors. So I think we have a great tight-knit community, and we all just understand each other. And I think there's no better thing than just, having that tight group and just seeing what your experiences are and just debriefing with them in a way. I think that's really cool.
Awesome. Thanks, Harnique. I don't know if anyone else has anything else they want to add at this point. Otherwise, we'll open it up to you guys for questions. If you want to just turn your mic on and ask a question, that'd be great. Otherwise, we can answer some questions from the chat as well. Just one question that's come up in the chat a couple times already is whether or not nursing is a good thing to take for going into med school. That's a question we get a lot, and we typically say no, just because as the students have mentioned, your first year, you have some courses that you have to take that are mandatory, but then you have a lot of option courses that first year, and after that, you're strictly in nursing courses, so you're not necessarily going to get those options you need to go on to med school. So it has happened. People can get in through nursing, but typically it's not recommended as your best route. So, yeah. Any other questions?
If I can just add on to the med school, just recently, specifically, the prerequisites have actually been removed, and people can actually enter from any stream they want. As Aaron and some of the other students have mentioned, that obviously having a background in some of those core courses like mathematics, biochemistry definitely do help with that prep and taking the MCAT and going into medicine. But yeah, and just overall, if nursing is something you're interested in, I think that you should definitely check it out, and it will likely change your mind and you'll fall in love.
Mm-hmm. Yes, that is correct. And UFC is one of the only nursing programs too that you can get in without certain prereqs. You can get in with other degrees. So if you want to apply to lots of med schools, again, nursing's not necessarily the best option. I asked about clinical. So yeah, clinical starts in your second year, and you have it every single term. You have clinical until you graduate, and your final term is all clinical. So there is a lot of clinical experience. Is there a co-op program offered in nursing? I'm not sure if anyone else knows.
So instead, it's not a co-op, but we call it a preceptorship program. And basically what that is at the end, and this is where perhaps, I think Zachary, are you in term 8? Who's in term 8? Do we have any term 8s? Maybe not, we're all of term 7s. So Term 8 is your preceptorship program, and you are assigned to a preceptor who is an RN in Alberta Health Services or a clinical agency that you will be working at, and that's where you work with your preceptor for your final practicum. So it's not per se a co-op, it's an integrated experience, like a hands-on learning experience in a clinical environment.
Thanks, Zara. Another question here is for people with mid-80s averages, and what would they recommend? For that, definitely talk to our admissions department, and they have a booth as well. But yeah, typically with mid-80s, it's usually too low to get in. There's lots of options to get into the program. There's direct, as Zara said, we've got the direct entry, transfer route, and degree holder. Direct entry is often your easiest. So again, that's with your high school grades. And if you've got your mid-80s, it can be just easiest to upgrade your courses and get that average up. Ideally, low 90s, you're typically safe to get in with that. You asked about the required course. Another question is asking about the required courses to take in your first year. I remember it's basically you've got your anatomy and physiology. So that's the one that the students here talked about where most years anyways, you get to go work in the cadaver lab and learn lots about anatomy and physiology. You need to take a statistics course. There's a writing course as well as philosophy. And I think those are the main ones. If I'm forgetting one, I'm good. All right.
You could take an option, science option, and so, you know, I could answer that question about the med school. This is where the reason why a lot of students don't come into nursing is because they need the sciences. And so if you don't take the science options, then you have to go back and do them.
Question here is about going into a rugby varsity program, and would you focus on the rugby program rather than taking additional option courses? That first year, again, that's the only year that you get options outside of nursing, and you have to get the 10 courses completed the first year. So you still, yeah, you have to make sure that you get all your courses complete. Sorry, just reading through all the. Oh, someone asked what you'd be paid for the clinicals. You don't get paid for the clinicals. Actually, you pay for the clinicals instead because they are part of your teaching. So you have, with the clinicals, you get an instructor both, again, and others can clarify, you have an instructor both on campus, and then you have your instructors in your clinical as well. So it is part of your learning. So you actually pay for your clinical practice because it is a course. So another question is, what are the differences between the U of C nursing program compared to MRU? And I don't know, Zara, do you want to take that one? Have you?
Sure, and I'm sure the students can pipe in as well because they probably know this as well. So nursing at the U of C is really focused on looking at it from healthy to illness. So it's you're looking at it from a health promotion perspective at the beginning, looking at the community population health promotion, and then moving into family health and family nursing, and then looking at it from more of an acute and chronic illness, and then specializing. So you know, and anybody can chime in here, Megan, Zachary, at any point in time here, but what basically the difference is that we go to clinical a little bit later. We don't start the acute care right away. We really hone in on skills in relation to critical thinking, reflective practice, looking at it in terms of how to develop your thinking around thinking as a nurse. So they used theoretical components like Tanner model and also the theory of knowledge in relation to really thinking about what that critical thinking piece is. So I don't know, the student wants to add anything, but I think that's what the difference is. We go a little bit later into the acute care setting.
Just another thing to add to that is that all the university programs for nursing are kind of standardized across Alberta and Canada. You have to meet the same kind of requirements. So it's all the same kind of elements. They're just kind of arranged a little differently.
Anybody else want to add anything?
I think it's also worthwhile to note that even though you may be getting into clinical later, having those critical thinking skills are super beneficial. Like you can practice and practice and practice IVs and you will eventually get that like dexterity, but like critical thinking is so much harder to develop than like a manual dexterous skill. And if I'm correct, Sarah, doesn't UC have a really, really good NCLEX pass rate? Woo.
Yes, so you know, across the country, we have ranked anywhere between first and second, and first in the province, second nationally. So our pass rate is quite high because of the way we teach critical thinking and the way a lot of our instructors do teach NCLEX as well, how to answer those questions. But yeah. So evidence informed as well. You'll see a lot of our alumni in leadership positions, you know, in a lot of the positions that require that extra level of critical thinking, informed decisions in relation to evidence, the leadership positions. So both programs are strong depending on your personality as well in terms of how you want to, it really is what you bring to the table. That's what I'll say.
All right. So then the other question here is if you have the option of pursuing small non-nursing courses in later terms than 1 or 2. And that people, sometimes people pick up another course like in the summer session, like when they have time off. So if you want to do that, it would be extra to your degrees. It wouldn't count towards the degree, but you'd still get credit for the course. But typically we don't allow students to take like an extra course in a term because it's already a full-time course load. So I don't know if any of the students have picked up any extra ones just for fun, but yeah, it would be possible in the summer, but not during your regular term because it's already a full-time course load. How many seats are there and what is the acceptance rate by percent? So how many seats there are, it can vary slightly from year to year. And it also depends on which intake route you're doing. Because again, we have that direct entry, transfer route, and degree holder. Direct entry, and I should know all these numbers, it's around 125 that we accept. As for the percentage we accept, I actually don't know that stat off the top of my head.
We get a high number of applicants, that's for sure. I think it's over 1,000, if I'm not mistaken, Erin.
Yeah.
And we do get quite a few applicants, and then you know, depending on, again, this is why it becomes so competitive in the nursing program, both at U of C and at MRU. I don't want to speak for them, but I know it's very highly competitive programs because we've got such high volume of interest.
Okay. I'm not seeing any other new questions in the chat here. So anyone else has any more, you can put them in the chat. And again, you're also very free to unmute yourself and ask a question in person as well. Get some discussion.
We had a question this morning from our earlier session about the class sizes and whether that it's supposedly bigger at U of C, that the class sizes are bigger, and does that impact your learning? The class sizes can be big, depending, like in first year, your kinesiology class is like 600 people. So that's very big. Your nursing classes are usually much smaller because we don't have that many students in that, usually in a term. But all of your hands-on like clinical practice and lab is in much smaller groups. Pre-COVID, your labs are 24 people, 16 people, and your lab group is, your clinical group is usually a group of 7 to 8, as Harnique said. So you do have lots of kind of like one-on-one and like small group instruction. And the professors and teachers for all of your classes are usually pretty easy to get a hold of. You can email, you can set up appointment times, and they're usually pretty willing to help you out.
Awesome, thanks, Megan. There's another question here about how easy it is to get a job after you're done university. If I'm correct, I don't think we keep specific stats on our graduates, although, do you know, Zara?
Yeah, we have a few stats, and I think what it is with nursing, it's always been difficult to get a full-time or a part-time permanent position. Nurses really do work casuals and part-time positions just because depending on where they're at. Some nurses like to work in 3 different areas. So, you know, you may have a 0.2 in emerge and a 0.4 on a medical surgical unit, and you could be casual on 4 different units. It's just the variety of options after you graduate. That's the beauty of nursing. When I graduated, you know, at that time they were hiring like crazy, but I decided to be casual because I wanted to work in 3 different units. And medical surgical units is, you know, I used to work at the Foothills Unit 62, which most of the students are out right now because of the COVID outbreak there. But, you know, it was a medical surgical unit and a very high intense that full-time would probably be exhausting, but I really loved working with maternal child as well. So I worked on Unit 52 for postpartum as well. So giving you a variety. So a lot of the nurses I find don't just work in one area forever. They actually do work in different areas. And I'm not sure if any of our students are working right now as well, but you do after term 7 you can work, or actually term 5 or 6, depending on your experience where you're at. You could work at the end of term 6 as an undergraduate nursing student. It's not a student, as an undergraduate nurse, and get that experience as well. So there are those positions, but a lot of our students start off working as healthcare aides and then moving their way into getting jobs. So if you're active and you're early enough in your nursing journey, that you definitely, there are jobs out there for casuals. Are any of you working right now?
Yeah, I can add a little bit onto that. I think, as you guys know, we're always going to be in need of nurses. So actually, there's a good outlook in terms of getting a job. But as people mentioned, it's quite difficult to get a full-time job in nursing. So a lot of times it is casual jobs that you guys will be getting initially to start off with. Another great thing that happens throughout our program is that when you're placed in your clinical setting, each semester is with a different focus and usually with a different population. So throughout your time as a student, you'll be accumulating a wide array of experiences with different populations. Like, for example, I was in orthopedics earlier, and then I was at a cardiac unit at the Rocky View. Now I'm doing oncology, and I've also got a placement rotation in adult mental health. And I think just overall having all these different experiences add a lot to your resume, and you can actually include all your different clinical rotation experiences part of your resume. And as when COVID actually hit, I was able to apply to the Peter Lougheed float pool as a healthcare aide, and I was able to pick up a position there. And now I'm currently working there as well as a home care position. So I think your clinical experiences are really valuable, and just that diversity and the different rotations you get put through add a lot of skills. And usually employers really like that, and they understand the program, the valuable program, and the credibility of the University of Calgary. And I think they really like that when students apply, and they're always in favor of applying students as learners, as healthcare aides maybe, or undergraduate nurses, as they know you'll be graduating in a few years and going into becoming the RN. So I think that keeping that train going, they really like that. And also your final term, which is your preceptorship, I've got a lot of friends in upper years and mentors and connections. And a lot of them have had great positive experiences where they've actually come out with jobs at the end of your preceptorship. Your preceptorship could, in a way, be like a 4-month-long interview process where you're getting used to that environment and just seeing what it's like. You're working almost full-time hours, so in a way you've already been trained on that unit. You know what type of patient population comes in, you're used to the different medications and diagnoses common to that unit. Just overall, you know what the unit culture is like. So employers and managers often feel happy to just hire you on as a casual and just give you that support and training.
Thanks, Arnique. I've got a question here too. Someone says they're interested in ER nursing. How do you get that qualification? Who wants to take this one?
I can take it. So when you graduate from UC, we all graduate with a general bachelor's of nursing. So you graduate with your RN, and then from there you can look at working in different areas and potentially specializing. And there's certification exams you can write through CNA to get your ER nursing certification. I don't know what the letter code is for it. And if you're super interested in ER, you could potentially get a final focus there. Yes, I hope that answers your question. As in terms 3 through 7, someone correct me if I'm wrong, students don't rotate through the ER. Yeah, so whatever you're interested in, you could look at potentially going into that for your final focus and potentially getting a job there at the end of your degree.
Yeah.
Some units also require 2 years of experience before they'll hire you, or for labor and delivery, they want you, if you want to do that for your final focus, they usually ask that you take that for your term 7, so that you have experience there. But not all units will hire new grads, because the care that they're providing is very acute, very critical care.
Yeah, and I think there's more so specifically applies to places like the ER and the ICU as well. You do have the chance of getting ER as your final placement in your term 8 preceptorship. But yeah, as people mentioned, oftentimes they do not hire new grads, and they'd like that you have usually a couple years of experience on an acute unit, or just have a different background, because it is quite intense, and they just want that couple years of experience of you developing your practice before you enter that sort of challenging environment. But I do have some friends that have been able to get it right out of their preceptorship, or have healthcare positions at the ER at different hospitals throughout.
Thanks, guys. Just another question here about someone said they joined late, and anyone that joined late, if they want to see this later, it's being recorded and it will be posted on our recruitment page. There'll be an open house page there. Every single session, so including ones we did earlier today, will be on there too. So you can definitely check those out later. So this is a good question. For the 2021 year, are the courses online or in person? And right now, and I'm going to pass this over to the students, because I think it'll be interesting to hear what their experiences have been since the world changed and school changed here. But right now it's mostly blended. So where there's some online and some in person. But who would like to explain kind of how it's been going so far?
Sure, I can take this question. So far this semester, we started in September. All of our lectures have been online. So I have an oncology lecture and a practice of nursing lecture on Monday, and then a palliative lecture on Tuesday. And also on Tuesday, we have an in-person lab. So we go in, we do the whole COVID screening. There's usually around 10 to 12 people, and we still practice our clinical skills there. So we do that once a week. And then on Thursdays and Fridays, we still have our clinical setting. So I'm at the Peter Lougheed Center. So we go in anytime from 6 to 2 p.m. or 2 p.m. to 10 p.m. And we just do our regular clinicals there. And that's sort of what the semester has been like so far with blended learning. If anyone else wants to jump in on that too.
Yeah, so as people have mentioned, the University of Calgary actually as a whole has taken on the approach of doing blended learning. So as you guys might be entering in your first year, I'm not sure what the circumstances will be then, but the university-wide, they've actually changed their calendar, and it's actually been a blended approach where any courses that are possible are going to be happening online, and only people that absolutely do need to be in person, that includes labs and clinicals and different hands-on practices where you need to get that learning, will be happening in person with like safety precautions taken with physical distancing, masking, and things like that. And that's all regulated by the University of Calgary. And so your lectures are all online, and when you're, for us, as Zach said, our labs are in person and our clinicals are still happening at the hospitals.
Yeah, I think that's a good explanation. And yeah, as they mentioned, like as for fall of 2021, your guess is as good as ours at this point, because who knows what will change in the world between now and then. But for now, this fall and winter are the same. And yeah, for next fall, time will tell. So, but I think for the most part, it's working well thus far, and that the nursing students have still been able to gain those skills that that they need. And yeah, another question about with COVID, have class sizes been restricted? And again, the lectures are all online, and then the labs are already quite small. I believe there always no larger than 8 in the lab groups. So, and that's the way it's always been. Lab groups have always been 8 or less. So I think we've discussed this a bit, but what positions are most readily available for newly graduated nurses? You guys know? What?
To the best of my knowledge, which anyone feel free to jump in and tell me I'm wrong. Typically, as Harnique mentioned, where you preceptor, it's like a 4-month-long interview, so there's a potential of you getting hired there. Rural Health is actually always hiring if you're willing to relocate from the city, is always a good bet, and med surg units are like good to look into. Honestly, I would recommend just like looking at job posting and seeing what areas require how many years of experience, because it totally varies by unit. It's a very difficult question to answer at times.
Maybe I can add in here, a lot of student successes have started when they finish term 4 and they actually go and get healthcare aid jobs, because that's where your journey starts in terms of developing your skills and your resume. And they do really look at the experience. And so by the time you get to terms 7 and 8, you've already had a year of healthcare and skill development that they do take into consideration as well. And it also develops your confidence as well in the nursing care that you provide. So that 4-month interview becomes a bit, you're focused more on not so much the skills, but really sort of fine-tuning your critical thinking skills, and really looking at time management, prioritization, and management of care and care planning. So I think starting early to get those foundational skills in really does help you in terms of your journey where you're going.
There's another question here. Is it recommended to get CPR first aid before applying? And you don't need it before applying. In fact, the certification can expire. So you'll need to then, if it expires too early, you'll have to get it later, because you definitely need that before you start your clinical placements. But yeah, if you apply and get into the program, we'll definitely let you know, and then we'll make sure at that time we'll let you know what sort of CPR first aid you need, and which places are the best ones to get it. So no need to rush into that prior to applying. So what year does Practicum start? I think we talked about this earlier, but yeah, Practicum starts year 2. Your clinical placement starts in your 2nd year, and you have it every single term till you're done. How many courses do you recommend to take per semester? The nursing program is different from other programs at the university in that you don't have a lot of flexibility on how many courses to take a semester. Your 1st year, you could have some flexibility, but if you want to progress to 2nd year, you still need to get those 10 courses. So if you want to space them out to spring, summer, that would be fine. But then you are in a full-time course load, and it's very prescribed. The courses are listed on our website. If you go onto the nursing website, of what you take each term. Most of the terms you take 3 theory courses, and then your clinical placement, which is a 6-credit one, which gets you basically the equivalent of 5 courses. So yeah, you just follow what we tell you to take, basically, for nursing. Is it better to take Math 30-1 or -2? For admissions purposes, for nursing at this point in time, whatever you feel you're going to do better in and get a better grade, so that you can have the most competitive average, because at this time we accept both.
In terms of specific to that, just be careful, and if you are applying to other programs, and just look at what their requirements are as well. You don't want to be kind of just like not making yourself eligible to even apply to some other programs. But yeah, what you can do better in, that's the way to go.
Yeah, that's definitely a good point, because many of the other programs will not accept the -2. So if you're not sure about nursing, or you have other choices, then definitely look at the requirements for those. As for where the recorded webinars will be posted, I don't have an exact link for that, but our recruitment department has let me know they'll be posted. If you go to our website under just the open house links, everything should be on there. So I haven't been given a specific spot, but just go to the open house page on our website, and all of the videos should be posted on there. Are there benefits to direct entry in nursing over completing a bachelor's and then entering nursing school? I mean, if you know you want nursing, direct entry would be the most direct route to go, I would say. I mean, a lot of people come in later, they've changed their minds after they do another degree, but there's not enough. And of course, I mean, if you have background of another degree, that's always going to be an advantage coming into another program, because you've already been in university before and you have those skills and maturity. But otherwise, if you know you want nursing, direct entry is definitely your most direct route. Yeah, so for again, the CPR first aid, no rush to get it yet, unless you want to for another reason. But yeah, you don't need to get it until after you've applied. You'll get your acceptance letter. We give you all the details at that time on what you need there. Oh, I missed a question here as to when is the best time to apply. Admission is open right now as of October 1st. If you can apply and get in via early admission, that is best, because if you apply later, all of our seats are sometimes full by that point. So the earlier you apply, especially with direct entry, the better. If you switch from nursing, or sorry, to nursing from another program, what are the requirements like the GPA? So if you're coming in from another route, which through our transfer route, for that, so that type of thing would be more of an admission question. It's, which technically I'm not supposed to answer on this as much, but I'll give you a really brief answer, which is the transfer route is very competitive. We only take around 25 people and a very high GPA is required. So you would have to do very, very well in your other program and make sure that you meet the prerequisites. But for that, you can definitely ask more questions at our Faculty of Nursing booth, which is open at the open house here too. Can you take a program before your first term starts? Sure. Okay, that seems to be most of our questions for now. Does anyone, and any of our volunteers here, do they, anything else they want to let our participants know?
Just on the question that was asked a little while ago about the courses that you're taking per term. For first year, you're usually taking 5 classes per term, making sure you get in the required classes for nursing. For years 2 through 3, well, 2 and 3, I guess, you're taking 4 classes or 4 courses per term. You're doing your clinical and lab, which is kind of one course, and then you're taking 3 theory classes. Then that's also for term 7, which is the first half of 4th year. And then term 8, which is your last term, you're in your preceptorship, so it's just the 1 class you're taking.
Thanks, Megan. I just see a question here asking if you need physics and if you need to pick it up. Again, it's not required for the program. So it's one you're going to do really well in and it's going to boost your GPA, then, or if you have other programs you might be interested in that need it, yeah, that would be up to you.
I can also speak to that. I took physics in high school, and I there's you don't need it. Like, there is nowhere that I have used physics in nursing yet. I'll let you know if it happens.
Good point. Good point. Well, unless like we're looking at somebody falls and maybe there's some physics there and the bone break. I don't know. I don't know. Is there any benefits to taking calculus for nursing?
I also took calculus. Why? I went to a very small high school where we didn't have that many options, so I just got stuck in science and math courses. No, I did not find any benefit for taking calculus. If you like math, it's like a fun course to take in high school if you want to like do like a calculus type math just to see if you like it or not. That's when I would take it, but I have not used it in nursing yet. I used more of like what we call in Saskatchewan a foundations math, like anything that's like stats based and like learning how to do like stats calculations is probably the most type of math I've used.
Math, you need it mostly for, as you mentioned, stats, but also medication calculations. It's very handy if you're really quick. So it's fast math. You kind of need that, and being able to convert and calculate doses, and so you need to be strong on those math skills.
There's a question here about the current competitive average. Last year, our final cutoff was around an 89.4, but to start for early admissions, I believe last year as well, it hasn't been set yet for this year. It was like around a 92, so definitely very, very competitive. Hmm. Okay. And I think we're actually, when will universities look at courses that you don't use to apply? I think maybe what that means is we've got the prerequisite courses that you have to have. There's 4 courses and then a 5th option courses, and the other ones, no, we just look at those 5. How much chemistry is in nursing? Anyone? No?
Chemistry is a fun course. One of my favorite sciences to take in high school, but yeah, you won't be really using that in nursing, I'd say.
I could add on to that. The part I used most out of chemistry was the calculations that Dr. Shajani had alluded to, like doing med calculations and ratios and canceling units, and like, what are those calculations called in chemistry that you do like that? I haven't taken it in 4 years. So yeah, that's
Stoichiometry or something.
yeah, that stuff. Like, that's the stuff that I found translated most.
Chemistry is really helpful for your pharmacy, understanding the medications and the pharm part of it. It does really impact your understanding. So I've had a lot of students in the past, because I teach the degree holders. So I usually teach in the spring. So most of my students are degree holders, and they come in from a science background, and they can quickly catch on the pharm piece so quickly, the epidemiology piece. So there are things that do benefit in terms of your understanding. Biology is huge. That's one of the things that I would recommend. That would probably be good to take. And then the chemistry piece is more so for understanding your medications and making those connections, and that's how you would understand it. So people who haven't taken chemistry, they don't maybe see any difference, but people who've taken chemistry actually do make the connections. I do see it in class, actually.
Okay. All right, and I think we're coming to the end of our time here. So if anyone has any other pressing questions, otherwise, here's one about, okay, this one was answered earlier, about the co-op program. So that you'd have to kind of revisit from earlier. Otherwise, I think we're gonna sign off here. So if you guys have any other questions, we still have the nursing booth open for another half hour till 3 o'clock till open house closes. So please come with those questions to the nursing booth, and we'll be there to answer them. Thank you so much to my volunteers here today too for helping. And you can also always contact us after today, nursing@ucalgary.ca, and we've got people answering your questions there all the time. So please feel free to contact us in the future with any questions you have. And thank you so much to everyone for joining us today. So, I know.
Good luck, everyone.
Yeah.